Thank you for being here today. I'm Marty Carty. I'm the Director of Government Affairs at the Oregon Primary Care Association.
And I'm Rachel Gerken. I'm the Director of Behavioral Health for Mosaic Community Health.
Thanks for joining us. We'd really love to hear from you about what brought you into the health center movement.
Yeah, to be perfectly honest, it was the Service Corps reimbursement program. So I had been working as a licensed professional counselor for many years and paying pretty hefty student loans. I was on the public service forgiveness loan program, and when we decided to move to Oregon, I knew I needed to find a job that would either match that reimbursement or be even better. And I found that with Mosaic. So I was able to put that financial burden behind me within 2 years and then kind of be on a better financial track for my family and I.
And so it sounds like the reason that you joined the health center movement was because of a program that could help lessen that burden for you.
100%. I really enjoy the work that I do, but at some point it doesn't become as financially viable if you don't have that support.
And maybe you could talk a little bit about, now that you're part of the movement, you've been working in this environment, what really inspires you about the work that health centers do?
Yeah, and that's kind of the second half of my story. Working in a school-based health center in a collaborative team model, I really got to see what it looked like to have the patient at the center of the model of care. I now understand what it means to allow access to all and just the quality of care that is delivered. So that's sort of become my passion. I really love mental health, I love behavioral health, but I also understand that people who can't afford it or who have just burdens in the way, like transportation, because they're working shifts that don't accommodate that, it can become not only a disparity, but actually a detriment for them to try to invest in their mental health care. So in this model, I understand now that one visit can actually allow you access to behavioral health, to pharmacy, to medical assistance, CHWs, the whole team. And it's just become something that I deeply believe in and am so happy to be a part of.
And you mentioned that you work in a school-based health center setting. Could you tell me why you love that so much?
Well, mainly because I love sassy teenagers, but they're there. And it may be that they're just trying to get out of math class, but it may also be that they couldn't otherwise access care at all if their parents aren't supportive of them reaching out for that care for some reason, or again, maybe families don't have access to the resources, maybe they're not English speakers, whatever it may be, they're at their school, they know where we're located, they can walk there on their own volition, and I think it's a real step in the developmental process of an adolescent to start understanding that they have resources available to them if they ask and they go get those. So there's many benefits to it, but mostly just having access immediately.